On March 6, a Chinese medical team performed a surgery that propelled West Africa's healthcare capabilities forward by 57 years. The story began 3 months earlier with an accident in Niger, West Africa. A 5-year-old boy suffered a left femoral fracture. After 9 unsuccessful surgeries by local doctors, his wound became repeatedly infected, leading to non-union of the bone and a 10-centimeter shortening of his left leg. Walking seemed impossible, and permanent disability appeared inevitable. Fortunately, Nong Jianbu, deputy team leader of the 24th Chinese Medical Aid Team to Niger and a trauma orthopedics expert, knew a technique called bone transport that could save the boy. He activated a transnational life channel to ship an external fixation, critical for the surgery, from China 10,219 kilometers away. The surgery succeeded, and after 100 days of recovery, the boy's left leg regained normal length by March 6th. He can now stand and is undergoing rehabilitation to walk independently. According to ChinaNews.com, this marked West Africa's first successful bone transport surgery. However, the technique itself is not cutting edge. It dates back to 1968, with the first clinical success recorded 57 years ago. Yet, in West Africa, even basic equipment like external fixation was absent. This gap, as revealed by the Chinese team's search across Niger's hospital, is largely tied to US sanctions against Cuba. Bone transplant, or the Ilizarov apparatus, was invented by Soviet physician Gavril Abramovich Ilizarov. In 1965, Soviet Olympic high jump champion Valery Brumel nearly lost his career after a car accident shattered his leg. Ilizarov's technique allowed him to return to the competition 3 years later. The method spread rapidly among Soviet allies, reaching Cuba, the socialist world's farthest member in the Western Hemisphere. By 1987, Cuba even issued a commemorative stamp honoring Ilizarov's contribution. This explains why China was surprised that Niger and West Africa broadly lacked this technology. Cuba has long provided medical aid and training to West Africa. In 2000, Cuba established medical schools in Gambia and Equatorial Guinea, sent professors to Ghana and Guinea-Bissau. Thus, the first successful bone transport surgery in West Africa should have occurred half a century ago, or at least 25 years earlier through Cuban or African doctors. So why didn't it happen? That's because the average cost per external fixation frame was $5,900. For African countries like Niger, their 2024 GDP per capita is only $752.15. This device was just too expensive. But without this equipment, even if doctors in Niger mastered the bone transport technique, they would not have been able to perform the surgery. Originally, Cuba could have also provided financial aid. From 1999 to 2015, Cuba was the world's largest net healthcare donor, contributing 31.2% of global aid compared to 10.6% from the US. The money came from Cuban medics who work in 62 nations, with 35 sharing partial costs. Cuba used fees from wealthier nations like Qatar to subsidize aid to poorer countries, while also supplementing its doctors' incomes. However, US sanctions stifled Cuba's ability to deliver such aid. Washington has labeled Cuba's medical missions human trafficking and even calling Cuban doctors slaves. In 2006, the Bush administration launched the Cuban Medical Professional Parole (CMPP) program, a brain drain policy incentivizing Cuban doctors to abandon international aid and work for US hospitals, with Cuba's per capita income under 1/10 of America's. The CMPP exacerbated Cuba's medical talent shortage, which reduced Cuba's ability to subsidize poorer countries. Moreover, under the US embargo since 1962, Cuba's economy stagnated. The blockade cost Cuba between $4 to $5 billion annually. Guatemalan researcher Henry Morales pointed out that without this burden, the island could potentially have doubled its international medical aid contribution. Though paused under Obama, CMPP was revived by Trump's administration. On February 25th, U.S. Secretary of State Marco Rubio announced visa restrictions on anyone involved in Cuba's overseas medical programs, including their families, further crippling Cuba's aid capacity. West Africa has been plagued by war and poverty due to historical European colonial plunder and triangular trade. The ideological confrontation of the United States is also hindering the people of West Africa from receiving international aid. However, now Rubio's policies could torture not only millions of Africans, but also many Americans and Europeans. First, Cuba's efforts curbed pandemics like Ebola in West Africa in 2014 and COVID-19 in 2020, where Cuba's Henry Reeve Brigade treated 1.26 million patients across 40 countries, including Western Europe. If Rubio's policies succeed, Europe may face unchecked outbreaks from future viruses. Second, Cuba excels in diabetes care. In 2006, Cuban scientist Jorge Berlanga developed Herboprot P, a drug preventing diabetic foot amputations. By 2017, Cuba had the world's lowest diabetes amputation rate, 3.8%, with only 480 cases nationwide in 2016. In contrast, The Guardian reported 154,000 annual amputations in the US that were 80% diabetes related. Despite 30 million US diabetics, the embargo blocks access to Herboprot P. The latest update on its potential US arrival, per Politico in June 2024, was titled "The Cuban Drug That Could Come to America," a title sneering in suspicion. The next 4 years may be tough for Nigerian patients, as Cuba remains distant from Africa but too close to Trump's White House. Yet, more comrades who are motivated by Cuban medical internationalism, particularly Chinese medical teams, are stepping in. Currently, China has sent over 30,000 medical workers to 76 African nations, treating nearly 300 million patients and training over 100,000 African doctors. Additionally, in May 2024, Russia provided Niger with humanitarian aid and military advisors to build an air defense system. By September 2024, Niger expelled all 2,500 US troops from its soil. Without the Stars and Stripes as a distraction, the Global South's white-robed angels can focus on saving more lives. Thank you so much for watching this episode of Top Picks. I am Mimi. Please comment below and make sure to tune in into the next episode.